Hi everyone, welcome to RAAONLINE. I am Dr. Ashok, Assistant Professor of Microbiology. So today we are going to see an important infection of central nervous system, that is the cryptococcal meningitis. So again it is one of the fungus which is going to cause meningitis in immunocompromised individual. Whenever we are going to deal with an immunocompromised patient who is going for meningitis, so there has to be some infectious etiology idea in our mind. So the most common etiological agent which is going to cause infection in immunocompromised individual is going to be our Mycobacterium tuberculosis, which is going to cause bacterial meningitis, and another thing is going to be the Cryptococcus, which is going to cause fungal meningitis in those immunocompromised individual. And these kind of pathogens is going to be opportunistic infection, so which is going to affect the immunocompromised individual. So when the patient's normal immune system is going to be there, the example, if there's going to be a better CD4 count, there is nothing going to happen. In case if there's a case of anything like PL HIV or people living with HIV, if they are not on a proper treatment, their CD4 count is going to go down, and they are going to put the patient in high risk of opportunistic infection like the cryptococcal meningitis and Mycobacterium tuberculosis etiology. So today we will see about cryptococcal meningitis. So now moving on to the definition of fungal meningitis and the commonest agent and what are the risk factor. And whenever we talk about fungal meningitis, the most common fungus which comes to our mind is going to be our cryptococcal meningitis. And if you are going to have a patient with immune suppression or immunocompromises, so this particular pathogen is going to cause increased rate of infection in those individuals. So the most common fungal etiology, once again I am repeating, it's going to be the Cryptococcus neoformans, and the risk factor is going to be the immune dysregulation. So most of the normal human they won't have any infection with the Cryptococcus neoformans, and most of the time it's going to be an opportunistic infection, and when the CD4 count is going to go down, it is going to cause the infection. And the immune dysregulation could be due to many factors. It could be either an primary immunodeficiency disorder like cellular immunodeficiency disorder or humoral immunodeficiency disorder, or any disorders which is going to affect the complement system. So those are the example for the primary immunodeficiency disorder. And the patient can have something like a secondary immunodeficiency disorder, where the patient is going to have some underlying issues. Example, the patient can be a case of PL-HIV or people living with HIV who is not on proper medication, and the patient can also be a case of uncontrolled type 2 diabetes mellitus. Again this kind of thing is going to put the patient into a high risk of opportunistic infection, and there is going to be an systemic immunomodulatory therapy. Example, if the patient is post renal transplant or post any organ transplant, so we are going to put the patient on any immunomodulator drug which is going to suppress the immune system. Again those kind of patient, again they are going to be an individual who is having a high risk of this kind of invasive infection. Example, the Cryptococcus neoformans meningitis, so which is a fungal meningitis. Now species. So whenever we talk about cryptococcal meningitis, there is going to be two species. One is going to be our Cryptococcus neoformans and another is going to be our Cryptococcus gattii. And again Cryptococcus neoformans has two subspecies. This is called as Cryptococcus neoformans var neoformans, and there is going to be something called Cryptococcus neoformans var grubii. So these are the various subspecies of Cryptococcus neoformans. So in general when you are going to study about cryptococcal meningitis, you just remember there is going to be Cryptococcus neoformans and there is going to be Cryptococcus gattii. And again a Cryptococcus neoformans, it has Cryptococcus neoformans var neoformans and Cryptococcus neoformans var grubii. So these are the subspecies. So these are the organism which is going to cause the infection in immunocompromised individual and end up in various forms of meningitis and also the various form of cryptococcosis. Now coming to the virulence. So pertaining to the virulence of Cryptococcus, it has its own polysaccharide capsule, phospholipase and urease. So with the help of these polysaccharide capsule, phospholipase and urease, it's going to escape from our immune system. So the most common immunity which is going to have an antagonizing effect towards the Cryptococcus is going to be our cell-mediated immunity. So whenever this particular pathogen is going to come inside, our cell-mediated immunity is going to go and act immediately. So what is going to happen is that with the presence of capsule, it's going to prevent the opsonization, and it's also going to prevent the complement-mediated lysis, and also going to prevent the phagosome-lysosome fusion. So thereby it is going to escape inside the particular macrophage and it's going to survive inside the particular cell and it's going to cause the infection.